Dr. Jordana here from EVS Pet Urgent Care, here to share some very exciting, revolutionary news with you. I am waiting for my colleague, Dr. Pabon, to join us to deliver this news. All right, well, I want to introduce you and give you a little bit of time to let everybody know here who you are and what we're doing. So again, I'm Dr. Jordana, and the owner and founder and operator at EVS Pet Urgent Care. Dr. Pabon is my colleague down in Kissimmee, Florida, and I'm going to let you introduce yourself here as well.
All right, yeah. So I am Dr. Pabon. I work here in Kissimmee. I am here to help your pets when they are sick, anything from like any vomiting, loose stool, dental issues, okay? We are here to help.
Perfect. So we are branching into a new area here in the urgent care space. And for me, it's bridging yet another gap in coverage for urgent care. In the last year, we've seen plenty of pets come in that are having problems with their mouth. Probably the most common thing that we see is a dog or a cat that comes in with a very swollen face that has, in the end, a diagnosed tooth root abscess. In the urgent care space, as of right now, we don't have the ability to fully treat that. So we can get these guys more comfortable using antibiotics, using some pain medication, but in terms of actually treating that tooth, we're ending up to have to refer those pets. And right now, our local emergency rooms don't do any type of dental procedures either. So most of the time, what we're having to tell these clients is, you're gonna have to find a general practice vet to get this taken care of, which leads us to why we're in the urgent care space in the first place, that it's very hard to get into your general practice vet right now. And that's if you have a vet, right? There's a lot of our clients that don't even have a primary care veterinarian at this time because of that delay in getting that type of care. So we're so excited to be able to bridge this gap in care. And I'm going to pass it over to you, Dr. Pabon, to say, what does a COHAT versus a dental cleaning mean? And what is the process going to be here at EVS Pet Urgent Care?
Yeah. I did want to add to that real quick. Just like in the past 2 weeks, I have seen 3 pets already that came in with a tooth root abscess. Okay, so hopefully soon we are gonna be able to take care of this in March. Okay, but to talk a bit more about a difference between doing a full COHAT, which is what we are going to do here, versus just a dental cleaning. So a COHAT starts before your baby goes under anesthesia, okay? We are going to run some blood work to make sure that it is safe for your pet to go under anesthesia, okay? That is the most important thing, is the safety of your pet. As long as the blood work comes back good, we can then start the procedure. Your baby will go under, and we will shoot some dental x-rays, okay? That is very important, because we can miss about 50% of disease if we don't do those dental x-rays, because we are going to be able to see signs of disease that are below the gum line, okay? And then after that, we will do some probing as well in the mouth to look for signs of pocketing, okay? We will evaluate each tooth to see if there are any kind of fractures, are they moving, and we will look for any signs of masses. Is there any kind of inflammation in the mouth as well? And of course, all this is going to be charted as well, so we have it on the records as well, okay? And then of course, we'll scale each tooth to get rid of all of the calculus and plaque beneath the gum line as well. That is most important to know, is there is a lot of plaque that builds up below the gum line, and that is a common source of disease, okay? And then we will of course polish each tooth that will help to reduce plaque buildup over time. And then based on our findings, we will make a plan for your pet, okay? And that will include recommendations for the future and things that you can do at home to make sure that your baby's teeth stay as healthy as possible.
Perfect. So as you can see from Dr. Pabon's beautiful explanation, this complete oral health assessment and treatment is much more than what we think of as just a dental. This is much more than just brushing the teeth. It's much more than just looking at the oral cavity. It's actually being able to examine each tooth individually and make a plan for the tooth, for the entire gingiva, for the mouth as a whole, and then even before that, like you said, taking a look at the whole pet as a whole as well, making sure that they are a good candidate for anesthesia, making sure that we're taking all of the necessary precautions to make this as safe as possible, and to make sure that we're taking care of any pain pre-operatively, intra-operatively, and then also once they're going home. So beautifully said. I want to take a minute to talk about what the scheduling process looks like too. So it is the month of February, which is National Pet Dental Health Month. We are going to be having these pamphlets being distributed to all of our local areas in both our Northbrook, Illinois location as well as in Kissimmee. In the month of February, if you come to either of these two locations, we are going to offer a free oral health exam. What that's going to look like is a complete physical exam, but really focusing on what the next steps are for this COHAT, including discussing any preoperative blood work. How do we, again, make sure that we are prepared for the day of surgery? If your pet comes in February with this flyer here, you'll see there is a 15% off code as well, coupon code for when you come in March, that total 15% off that procedure. So please call 877-EVS, that's 877-874-4838. You can schedule your appointment with us for that oral exam, and our goal is to be able to continue to expand these services and fill this gap in coverage and get pets feeling a whole lot more comfortable. Thank you so much for joining us this morning. Thank you, Dr. Pabon.
Thank you.
You're welcome. And if you have questions, please feel free to write them here, and we'll get back to you as soon as we can. Thank you so much. Have a wonderful day.
See you soon. Bye, guys.
Bye.